time, like I always say.
Ready?
Yep.
The Unknown Zone.
Talk show.
The Unknown Zone.
Ready, Phil?
Yeah, I'm ready.
Okay, do it.
And now introducing the Del Bigtree of Brooklyn Public Access and nominated at the Be Free Awards last year as most hilarious show, Yvonne Dillette.
Yay! Thank you, Phil. Can I tell you, that was probably the best introduction you've ever done on the show. He usually screws it up, but I don't care. So welcome everyone. I'm your host, Yvonne Dillette. Welcome to the Unknown Zone Talk Show. Today, I have to say, unfortunately, our clown and his sidekick, Happy and Polly, will not be here. Just want to get that out, at the beginning, because he works with handicapped adults, and he was staying at the home, and one of them had seizures today, so he's in the hospital with them.
Yeah.
I know.
Our thoughts are with him and the
Yes. And we had a little rehearsal yesterday, and he was there, and we got to meet one of his, I guess sometimes they call it clients. They call them clients, and she was the sweetest thing. I think she was, I don't want to say mentally, what is the proper term these days? In the old days, it'd be mentally retarded. Let's, say what it is, what it was. Anyway, she was adorable.
She's special.
Yeah.
It would say special needs.
Special needs. Okay.
She's adorable.
She was adorable.
With the people with special needs, you really see how people really kind of are without the facade of all corruptness around them.
Special. I just want to say, I used to work in an office, and all the male people were the special ones, and they were the good eggs. They had the heart of gold. They were just, I love them all. I almost feel like they got a free pass this lifetime, but we'll talk about that because I want to talk about lifetimes and all that stuff. So I want to introduce Phil, my sidekick today, and the band, or as I like to call them, Sloppy Seconds, and my special guest today, who is a medical intuitive, an entrepreneur. I want to say chronic entrepreneur. Serial is much better. Serial entrepreneur, businesswoman, and inventor, Julie Ryan. Yay.
Hello.
Welcome, Julie. Welcome.
Thank you for having me.
Yes, my pleasure. And I'm glad you mentioned before we started taping that you lowered your IQ for the show, and I appreciate that.
I did.
Is this your first comedy show?
No, it's not.
Oh, really?
Mm-hmm.
Okay.
Ryan Singer comes to mind.
Okay, that name sounds familiar.
Yeah. And the funny thing is, he lives in LA, of course, because, he's in the biz. He's been in movies too. But he's originally from probably an hour. We grew up about an hour apart. And of course, I was grown and raised by the time he was born. But, we had a lot in common growing up.
Oh, wow.
In Central Ohio.
So that could have been like I want to say, a past life thing in a way. I find that a lot of times connections, when I connect with, right?
Everybody in your life you have a past life connection with, even the checkout clerk at the grocery store.
Which I always feel a special bond with, by the way.
There you go. Yeah.
So welcome. I just want to say, Julie, I had a reading with Julie recently, and it was awesome. And I want to tell you, without going into specifics of my issues, that I feel like you did a psychic surgery on me. And I think it's very possible that you did. Is it possible that you cured that thing?
I call them energetic healings.
Okay.
And I don't do anything. I'm kind of like your tugboat captain, helping you navigate your ship up through the Mississippi River. So it's spirit working through me and with me, and it's you healing yourself. Just like no doctor's going to heal you, no surgeon's going to heal you ever. They're going to give you suggestions of things you can do so you can heal yourself. And that's how energetic healing works as well.
Okay, that's interesting. because it was funny because I felt like I have been searching. I've done a lot of different holistic modalities. I've been working with a nutritionist. We talked about that. And I feel like this one issue had been plaguing me for a long time. And I don't know why. I guess what you're saying is that through your energetic healing with me, that is it possible that I was ready to heal that particular thing?
Absolutely. What happens with energetic healings, Yvonne, is they happen on the energetic level. That's a lot of energy is used, in one
Sure.
sentence, but
Yeah.
healings happen on the energetic level, and then they integrate into your body. And that can happen instantly. It can take days, weeks, months. It may need some kind of complementary care, like surgery, like change in diet, like medicine, like physical therapy, things like that.
Right.
But at the end of the day, it's always our spirit's prerogative to utilize the healing or not to help facilitate whatever it is we're exploring. Because we all come in with basic scripts of things we want to explore in this lifetime.
Mm-hmm.
And so the healings that I participate in, I believe are an adjunct or a part of the equation of what Western and really even Eastern medicine do. And all of it together is allowing us to heal ourselves.
Right. And that, to me, see, that is the ultimate, is being able to know when to use which.
Well, and I think what people are finding out is it makes sense to use a combo platter at times.
Right. Whatever you need. Exactly.
Absolutely. And I think a great example, because we've had a private session, that I talk in analogies a lot because it gives our human minds a frame of reference for this woo-woo stuff that we're doing.
Right.
And if you think about a surgeon who has two patients back to back, two surgeries back to back, exact same procedure, both patients are young and healthy, no issues health-wise at all. And they do the procedures and they both go perfectly. They wouldn't have changed a thing. One patient heals quickly, the other patient has challenges. How do you explain that? You explain it in that it's that person's spirit's prerogative, again, to utilize the healing or not, to experience whatever it is they choose to experience in this lifetime.
And I find it's so interesting because there's also the emotional component.
Oh yeah, always.
Right? And the spiritual component.
There's always an emotional component to every medical condition. Every psychological condition as well, which a lot of it's medical because a lot of it's caused by, brain gut biome connections and things like that. But there's always an emotional component that's in place that causes an energy block, that causes a rupture in the energy filled membrane, which allows a leak. The body's leaking energy, and that always precedes any kind of medical condition. And as you know, we can go in and find where did that block originate. The block, like Eastern medicine, acupressure, acupuncture, clear the block, get the chi to move, that whole concept.
Oh, yeah. Oh.
Right. It's caused by an emotional event, either in this lifetime or a past lifetime. It could be something serious. It could be something simple, like somebody called you a bad name when you were little. Somebody called you a clown when you were little, and it hurts your feelings. And we look at that now.
That would be a compliment for me.
Yeah. Exactly. Well, true. But, somebody else, maybe that was a serious child.
Yes.
And you look back at that and you think, well, that was no big deal. But to your 3-year-old little self, it's a big deal.
Absolutely.
And it causes an energy block that then gets in place. Other life events, energy piles on top of it, eventually causing enough pressure, causes a blowout in that membrane, allows an energy leak. It's like your car's not running on a full battery. Stuff's going to go wrong with it, especially today's cars that run so many electrical things.
And you have to do maintenance. I mean,
exactly.
if you don't take care of your car or your body, a lot of people think there's the quick fix, and if you're eating crap, there are going to be consequences.
Well, and everybody wants a pill because that's how we've been conditioned over the past 50 years, that there's either a pill or a surgery that's going to fix everything. And most root causes of illness start in the gut, and it has to do with our diet, believe it or not. There's a great book called Why We Get Sick by a scientist at Brigham Young named Ben Bickman. And he talks about that most of us are insulin resistant, not diabetic, but insulin resistant. Like 80% of us are insulin
Wow.
resistant. And that's the root cause of most illnesses. So you fix what the cause is, if you reverse engineer it, you fix what the cause is, then the symptoms go away. And
Right.
most of it is in the gut, which is where 80% of our immune system is based, is in the gut.
Right. Are you a fan of Louise Hay?
Oh yeah, sure.
So I remember her book, You Can Heal Your Life.
Right.
Right. And I would
Yeah.
at times go to different illnesses to see what might be going on or not, wrong with me, to see the emotional component of what I might need to work on, as well as taking care of myself physically.
Oh yeah, she was one of the pioneers. Herbert Benson at Harvard.
Okay.
I heard him speak probably, oh my gosh, maybe close to 30 years ago. He was doing this. The
Wow.
Canyon Ranch guys.
Oh, sure.
The Dr. Weil, the Deepak Chopras. I mean, all those guys.
Right.
Those guys have all been basically on the same bandwagon with all of this for decades. And more people are starting to take it to heart, I think, because traditional medicine techniques are not helping them feel better.
Correct.
They go to 10 doctors and they still have the same symptoms. And they're saying there's got to be more to this. I've had every test done, known to mankind done. They've checked me from stem to stern. They've done surgeries on me and I still have the symptoms. If not, they're worse.
Correct. I actually have a friend in recovery. I'm sober, I think I told you, 31 years. And I have a friend who wrote a book about her recovery, and she has been on every antibiotic, whatever, all traditional medicine. And just yesterday said, this last antibiotic isn't working. And I started to research the gut biome. And I was like, you go, girl. Like, that's what it took for her. And I think she's 50.
Well, so let's reverse engineer that even a little bit further. I believe alcoholism is a sugar addiction.
Absolutely.
Because you don't have to absorb it. I mean, it's like a sugar IV.
Oh, for sure.
And when we are on that much sugar, it causes inflammation, causes our gut biome to get messed up, the ecosystem in our gut, which whacks our immune system, which puts us on antibiotics, which whacks it even further. And then we crave sugar because we have an overabundance of yeast. So what are we doing? We're either drinking the sugar in a form of a sugar IV and alcohol,
right,
or we're eating sweets, because what do they do with alcoholics at Alcoholics Anonymous meetings and other things? They've got tons of sweets there for them.
Exactly. And that's what they tell you to do the first year.
Right.
So, so you don't drink, whatever, but that's exactly it.
So you're just,
you basically replace something else that's
exactly
not as horrible at the moment.
Well, yeah, but the other thing that's really interesting about that, and I'm an expert on yeast overgrowth because I had it for the first 40 years of my life. I was put on an antibiotic when I was a day old.
Wow.
Because I caught a staph infection in the nursery where I was born.
Mm.
So my poor gut didn't have a chance. And when I moved to Birmingham, Alabama, where I live now, I met the man who discovered and really pinpointed and was able to treat systemic yeast infections, yeast overgrowth. And he called his books The Missing Diagnosis, the late Dr. Truss, Truss. If you Google his name, he's like thousands of hits.
I was going to write it down, but I just have to look back
yeah.
at the video later.
So he got me well. He had people from all over the country that would come to visit him. He had people from abroad that would come to visit him.
Wow.
And he was an expert witness in several court cases where somebody was arrested for DWI and they swore up and down that they hadn't been drinking. And he knew they had yeast overgrowth, which turns our gut into a fermentation factory. So their blood alcohol level was over the legal limit. So they threw him in jail for 2 or 3 weeks. He got them to retest their blood. Well, their blood alcohol level was even higher in prison because they were eating all carbs. Right? Because the diet's not gourmet.
Terrible. I feel like I would die in prison, honestly.
Oh, and so he would go testify on their behalf and he would get them released. Their blood alcohol level was higher than a DWI, what it takes to get arrested. And there are lots of cases like that out there. So think about this. You've got yeast overgrowth. You're craving sugar. You're drinking alcohol. it's like pouring jet fuel on the fire.
Yeah.
And your blood alcohol level is high from the booze, but then let's double it because of the fermentation factory going on in your gut. I mean, it's really pretty interesting.
It's amazing. I love it. I love it. And I have my own history of how I started to get into holistic modalities and whatever, but I was curious. It sounds like you got interested at birth.
Well, I think part of the reason why I moved to Birmingham was to meet Dr. Trust, because he died a couple of years after I met him and he got me well. And so now I help people all over the world with this. And I swear, I think he's sitting up on a cloud someplace going, you go, girl. Because I'm teaching people things that he got ridiculed at the medical conferences. You can imagine.
Know what happens to a lot of doctors.
And most mainstream doctors are clueless about the gut and about yeast overgrowth. The other biggie that I see a lot is exposure to mold.
That's the thing that you told me that it was new to me, and I'm looking into that as well, which is, I'm so grateful because I want to have as clean an environment as possible. But like, who do you go to? Like, I happen to find you, by accident, right? And then I learned the next step in my evolution of health.
And so when I am working with somebody doing a medical scan, and I'm a buffet of psychicness, so I do it all. We can scan you medically. We can talk to your dead grandma. I can scan your cat. We can do past lives. I can tell how close to death somebody is. We can talk to your spirit guides, your angels. The whole 9 yards.
Amazing.
Because once you connect with spirit, and this is what I teach people all around the world, is how to do this. Once you connect with spirit, you can take it anywhere you want. And when I get somebody on my radar, like I did with you, this, it's like I have a hologram of them in my mind's eye. And it's as if I'm a human MRI. I can see broken bones. I can see torn ligaments. I can see metastasized cancer. I can see mold exposure in your body. I can see in my mind's eye overgrowth of yeast. And it just comes to me. And then immediately, as soon as something's identified, there's an energetic healing that begins.
And when did that start? How did you know?
How did I start? I learned how to do this stuff.
So, but what was your first experience that brought you to being curious and learning? And
I'm an inventor of surgical devices sold throughout the world, and I'm an entrepreneur. You said I'm a chronic entrepreneur. I love that.
That's
like
give me
a medical condition.
Julia, what was one of the devices that you use, that you developed?
I've invented orthopedic surgery devices, Phil. And so some of them have been on the market for 30 years globally and still are. So my best known one is called a disposable auto transfusion device for total joint surgery, which in English means when somebody gets a new hip or a knee or a shoulder, the bones bleed post-op. And they'll put a drain in. And my device collects that shed blood, puts their patient's own whole blood back into them so they don't have to use pre-deposited blood or somebody else's blood from the blood bank. And that's been sold.
I've been involved in all those surgeries.
Oh, you have? How so?
Yeah, I'm an X-ray technologist, so I've been involved many times.
Yeah.
And I've X-rayed them many times post-op as well.
Yeah. So one of my other best known devices, you guys are going to love this, is called the BASS, like the fish, BASS. And the BASS stands for the big ass suction system.
Nice.
And it's a mat that's hooked up to suction that goes on the floor of the operating room. And when a knee or a shoulder or a hip are being scoped, there's lots of irrigation fluid, gallons and gallons and gallons, liters, they call them in the OR. And it comes out of the patient's knee, for example. It's contaminated and it goes all over the floor. And it flows out underneath the door of the OR into the hallway, and people slip on it. I mean, people that are working in surgery wear galoshes in those cases. So I invented the BASS, which not only collects the fluid, but it contains it and then evacuates it. It keeps the floor dry, which is better from an infection control standpoint, but it's also better from a safety standpoint as well. And the interesting thing about it is how I came up with that name was one day I was testing a prototype in Nashville, Tennessee. And this Bubba of an ortho tech looked at me and goes, "Damn, lady, this is one big ass suction system. Y'all need to call this thing the BASS." And so I did, and then I trademarked it. And so it was the BASS. I only got one call from one client out of all my global clients, and it was a Catholic hospital in Wisconsin. And it was the materials manager called me and he said, do you think that's appropriate to put on a box coming, to put on your product coming into a Catholic hospital? And I said, well, I think it's funny. And he said, but do you think it's appropriate? And I said, well, it's only on the outside box. What do you box? You take it out of the cardboard in receiving. What do you have, Sister Mary Holy Water unpacking boxes in the hospital? And he said,
always a critic.
Yeah. And he burst out laughing and he said, no, he said, I just wanted to talk to the person that came up with that name. He said, we have copies of your labels on everybody's bulletin boards in receiving because it's just so funny. I said,
awesome.
Well, good. Yeah.
So how did you know that you were, because you could do remote,
No, I didn't know. I'm not one of those psychics who's had dead people chasing her since childhood, or if I did, I didn't know it, let alone what I would have done with it. So no, somebody gave me a book, a girlfriend gave me a book about 30 years ago called Anatomy of the Spirit by Carolyn Mace. And she calls herself a medical intuitive. Well, I've been in the medical supply business for 10 years at that point. And I said, what the heck's a medical intuitive? And so I wanted to know more. So I read her book. And after reading it, I went to the bookstore because we didn't have the internet yet.
Sure.
And I figured the bookstore might have more on this topic than my local library. And so I went to the bookstore and I found a book called Hands of Light by Barbara Brennan, who was a former NASA physicist who parlayed very complex quantum physics principles into understandable English for the non-scientific mind. That would be me. And she talked about energy healing and how to use energy medicine and stuff like that. So again, I wanted to know more. And I called her school, which was on Long Island at the time. And I said, do you have any graduates here in my area? I was living in Nashville. I said, do you have any graduates in my area teaching this stuff? And she said, yeah, as a matter of fact, I do. And, the school, whoever I talked to. And so I studied with this woman for 6 years. And now I teach people around the world how to do all this stuff that I do. And what, fast forward 40 years from when Barbara Brennan's book was released, it's now, I teach it in 4 Saturdays, 2 hours a Saturday, and they are able to do everything I do at the end of 4 Saturdays, basically 8 hours. And people say, well, how can that be if you studied it for 6 years? And I literally paid the equivalent of an MD or a PhD to learn this stuff. And I say, well, it's kind of like communication. We used to use carrier pigeons, and then we switched to, Wells Fargo and the Express, the Pony Express, and then we went to the mail, and then now we're on the internet, and now we're on the phones, and all of that. It all speeds up.
And don't you think I hate to use the term wave of the future, but we are entering the age of Aquarius. And do you believe in like the 5D, like we're in 3D and we're moving into 5D, like it's going to be way more common?
I don't really understand all that stuff. I hear it referred to, and I'm like, okay, fine. I have no clue what it means, honestly.
Yeah.
I believe that every generation comes in more advanced. We've all seen a 1-year-old that can't talk in sentences yet be able to work an iPad.
Exactly. Right.
Yeah. And I'm going,
true.
I don't even know how to work an iPad that well. And here's this toddler that's navigating the technology like it's nothing. It's like they come out of the oven like that. So I believe that every generation comes in having benefited from the previous generations. Mm-hmm. And as a result of that, everybody comes in with the ability. Everybody always has come in with the ability, intuitive ability. It's just a matter of developing and enhancing it. And we've all had experiences where we think of somebody and they call us or they text us or we run into them and we say, oh, what a coincidence. I was just thinking of you. Well, no coincidence. That was your telepathic, your intuitive mind working. And the other thing is little children are all able to do this until at the age of about 6 or 7, when they've had enough adults say, oh, honey, that's just your imagination.
I know.
You're not really seeing that old man's spirit in your room and being able to talk to him.
Right. Even though you are.
And the grownups can't do it, which is why I released my children's books, because I had so many moms say, can you put something together so I can help explain this? I have fun story real fast about children.
Show. The Unknown Show.
Talk show.
The Unknown Zone.
Talk show.